of Pro Diagnostics, Pune. I am thrilled to be a part of Baby Chakra and to be conducting this live chat on investigations done during pregnancy. So, this is a topic which everyone is quite unaware ki what is exactly happening. Why are so many tests given to us? So, let me first start by telling that these tests, every test has a reason. So, our pregnancy is a physiological process, and our pregnancy is divided into 3 trimesters. The first trimester is up to 12 weeks, the second is from 13 to 28 weeks, and the third is onwards, like 29 to 40th week, or the delivery of the baby. So during the first trimester, as soon as you know you're pregnant, your doctor will give you a huge list of tests, and you're always wondering why are so many tests given to us. So let's just understand why. So the tests routinely given are hemogram, which is CBC, as you all know, then blood sugar fasting and postprandial. You have blood group, you have VDRL, TSH, then you have those sexually transmitted diseases like hepatitis B, HIV, HCV. These can also be transmitted from mother to baby. Then you do something called as HB electrophoresis or the hemoglobin electrophoresis, which and then there is a urine routine. So now let's delve into the tests one by one. So first is a hemogram. You all know that what a hemogram consists of. It consists of hemoglobin, your total WBC count, your platelet count. So in case a hemogram is essential because this helps the doctor to figure out if you are anemic or not. Okay, so you need a hemoglobin, a certain hemoglobin level that is more than 11 grams per DL as per defined by WHO for a pregnant lady, that an 11 gram and above hemoglobin is essential for a healthy pregnancy. Then the next is our blood sugar levels. So blood sugar levels are done in the fasting as well as postprandial, which is done 2 hours after you have a meal. These tests are done to test called TSH, which is done to detect if you have any thyroid abnormalities. Then you have the tests called hepatitis B, HIV, and HCV. These are all viruses which are transmitted from mother to baby during the course of pregnancy. So these need to be treated, or in case of HIV, the viral load needs to be reduced so that the baby is not transmitted with these disorders, with these infections. Sorry. Then you have a test called VDRL. VDRL is a venereal disease research laboratory test. It is a non-specific test which can come positive in syphilis, and it can come positive in connective tissue disorders. So why you say is this test important? This test will tell you if you are positive for either or in syphilis or in venereal disease. In connective tissue disorders, usually what happens is that there are chances of spontaneous abortions. So this test, if positive, then there is an alarm where the doctor has to be more vigilant. Then you have the test blood group. Blood group, yes, very important, because in case the mother is Rh negative, then during the pregnancy she has to be given some vaccines. Anti-D is given so that the pregnancy is uneventful. Then there is something called as HB electrophoresis, which is something that abnormal hemoglobin we detect. For example, hemoglobin disorders like thalassemia. So these are some disorders which are transmitted from parents, genetically transmitted from parents to children. And these disorders are usually associated with a lot of blood transfusions later on. So this is just an example. There are many other blood-related disorders like hemoglobin disorders. So rather than giving a child a life, which so to figure out whether the child will have thalassemia in further, and to give it a child of recurrent blood transfusions, we usually do the screening before in the first trimester. So first mothers is done. If mother is a carrier or mother has thalassemia, then the paternal hemoglobin electrophoresis or abnormal hemoglobin analysis is done, and then accordingly the doctor will guide the couple regarding the pregnancy. Then there is a very simple urine routine test, which is done to analyze if you have infection or if there is protein loss in your urine. In cases of protein loss, the doctor has to be vigilant for preeclampsia and eclampsia. Then there are some higher end tests, which are, first is a torch complex. So torch is done to detect Toxoplasma, rubella, cytomegalovirus, and HSV, that is herpes simplex virus 1 and 2. These infections cause fetal abnormalities and growth problems. So these need to be detected. So this test will tell you whether the mother has active infection or uh, or if it has a passive infection, like it was a past infection. And then there are marker, just in short, then there are marker tests, which are dual markers, which are done in first trimester. Then there are triple and quadruple, which are done in second trimester. These are very important because these tell you about the chromosomal anomalies. Okay, so chromosomal anomalies, this can help you to rule out whether the child has Down syndrome or anything else, so that what happens is we can take an informed decision that if the tests come positive, then with the chromosomal anomalies of 13, 18, and 21, if it comes positive, then we can make an informed decision whether or not to continue with the pregnancy or whether to have an affected child. So that we must do before 20 weeks, because in India, the norm for MTP is 24 weeks. So beyond 24 weeks, you cannot have an abortion. So you need to do these tests. So these are very important tests. Fine. So let us go with the test. Some questions I'm receiving here. So is it necessary to repeat all blood tests every trimester? See, it is necessary to repeat your hemogram, your blood sugar level, your thyroid test, and your urine test. Okay, so these are the tests which are a must that you must repeat every trimester. And as per my opinion, you should repeat your thyroid TSH levels every 3 to 4 weeks, because uh, those tests help you monitor the growth of the child and in case figure out if you have diabetes or any sort of thyroid abnormality. So the next question that I have is what investigations are a must in last trimester? Fine. So last trimester, the investigations that I will suggest are a must are your hemogram, CBC, TSH, hemogram, CBC, TSH, and urine. These are a must before you go for your. These are a must in your last trimester. Rest of the investigations are as and what suggested by your clinician. Okay, this is a good question that I've received. How often should I investigate for blood sugar levels when suffering from diabetes during pregnancy? Okay, so this is a question. This is a question usually arises when you have a lot of predisposing factors. So predisposing factors are like if you have a strong family history, if you are overweight, if you have a history of excess weight gain in during the pregnancy, or if you have a history of gestational diabetes in your previous pregnancy. So in that thing, we suggest that you get yourself screened for diabetes uh, as and when you conceive, and then you get yourself screened for gestational diabetes in between 24 to 28 weeks. So in this case, we advise you to keep monitoring your blood sugar levels and HbA1c, and the ideal goal is that you keep the fasting level of your sugar less than 95 milligram per dl, and your postprandial, that is 2 hour after a meal level, less than 120 milligram per dl, and your HbA1c less than 6%. And I would suggest for patients with gestational diabetes, they should get their blood sugar levels checked every 2 weeks, because maintaining a good glycemic control in your blood is very essential. Because in case the glycemic control is irregular, then there are a lot of problems that you can face, because the baby can have malformations, there can be a large baby, there can be abortions, there can be death of the baby, and such deaths do not have any cause. So these can happen. That is why a glycemic control needs to be maintained. And I would suggest in the last trimester, please get your blood sugar levels checked. If you have diabetes or gestational diabetes, then you should get them checked every 2 weeks. So next question that I have received is why is thyroid investigation necessary in every trimester, even when I do not suffer from thyroid? So thyroid gland secretes your thyroid hormones. It is a very crucial hormone in your body. So what happens is most commonly females are at a higher risk of thyroid abnormalities, and routinely, if you see, many females are carriers and they are euthyroid. That is, they do not show any symptoms or they are managing to go by. But during pregnancy, there is added pressure added pressure on your thyroid gland because of the growing fetus, and also because your HCG has some similarities with your TSH. So all of these factors have an added pressure on your thyroid gland. So in such situations, during the entire course of the pregnancy, what happens is that you can develop a thyroid disorder anytime. So it is not ki tumko first trimester mein hai, then you will only have 2 checks in the first trimester, on the second or third. But we suggest that you test yourself for thyroid every 3 to 4 weeks to avoid conditions like hyper and hypothyroidism. In such situations, what happens is, again, the fetus is the one who's suffering the brunt. So there can be abnormal growth, it will affect its growth, then there will be abortions, there will be stillbirths. So all these cases that should be avoided by just doing a thyroid level testing every 3 to 4 weeks. So what investigations should I do for should I do to check for fetal heart rate and cardiac health? So see, there are no investigations as per pathology tests are included. These investigations are mostly done under radiology. So in radiology, I would just tell you that you keep doing your USGs, those are ultrasounds regularly, and your scans regularly. That will help you monitor your fetal heart condition. So now coming to an end of our talk, I am summing up today's discussion that I would just like to say that pathology tests are the backbone in providing you a good treatment by your clinician. So you must get your tests done from a qualified pathologist timely to ensure that your pregnancy is healthy and that you deliver a healthy baby. So that is my takeaway message from today in today's chat. Are there any more questions? Yeah, but yes, make sure you keep doing your hemograms, blood sugar levels, thyroid and urine checkup again and again. Okay, so no questions. So I'd like to thank the team Baby Chakra for this opportunity. Thank you so much. I hope it was informative. Thank you.